Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, this is Lindsay Smith Rogers, producer of Public Health on Call. Today, the HHS announcement that it's changing its recommendations for childhood immunization. Dr. Josh Sharfstein, a pediatrician and former public health official, joins me to talk about what the announcement means, how it came about, and what comes next. In part 2 of this series, which we're also releasing today, we'll dive into some of the diseases prevented by these vaccines. Let's listen. Dr. Josh Sharfstein, thanks for joining us today on Public Health on Call. How are you doing? It's good to see you.
Lindsay, I'm doing okay.
So, in what capacity are you joining us today?
Well, not as a podcast host today. Today, I am a pediatrician. I'm a former health commissioner for the city of Baltimore, where I was responsible for the vaccination of children in the city, and a former health secretary in Maryland, where I oversaw the state vaccine program, and a former official at the Food and Drug Administration, where I worked on the review and approval of vaccines in this country.
And today we're talking about the HHS announcement that came out about pediatric vaccines. So can you start by telling us what that announcement was and what happened?
Sure, it's a big deal. Announcement happened in the middle of the day. HHS changed the childhood vaccine schedule. This is a set of federal recommendations for when children should be vaccinated. And what they did was they took certain recommendations and got rid of them. Recommendations that all children should be vaccinated against several diseases, in particular hepatitis A, hepatitis B, meningococcal meningitis, influenza, and rotavirus, and said where before the schedule said every child should be vaccinated, that was a recommendation. Now it says that every family should have the opportunity to choose vaccination after a discussion with their healthcare provider. And officially, that's not considered a full recommendation. It's considered something called shared clinical decision-making. So it was a shift of a number of vaccines out of the fully recommended category.
What was the rationale for that shift?
Well, it followed a request from the president in a memorandum that HHS align the schedule of recommended vaccines in the United States with the schedule in other countries. And so there was a memo put together, and the end result of that memo was that this is where they landed. It's pretty interesting because other countries are all over the map. Some of them recommend vaccines very similarly to the United States. Some of them recommend fewer. But to me, what's interesting is the charge was, let's find ourselves somewhere in the middle of the pack. That's not usually how we approach things. Usually we want to be the best. As the pediatrician, I want us to have the recommendations that best protect children.
And so where did they land with that? Whose recommendations did they decide to follow?
It's kind of a mishmash. For a while we were reading that they were going to pick Denmark, but actually there are more recommended vaccines here than what Denmark has. But they're fewer than a number of other countries, including, I believe, Canada and Australia.
Why do different countries have different recommendations for vaccines?
To start, countries have different policies on many different topics. Countries have different building codes, countries have different healthcare practices. So it's really not surprising that they have different approaches on vaccination. But in particular, for vaccines, the actual diseases appear differently in different countries. Some diseases are more prevalent in one country than another. And so the impact of vaccination will be different from one country to another. Some countries invest in the science to build up vaccine options to protect children. They're at the forefront. The United States has been at the forefront, leading the world in vaccine development and in keeping kids protected. It's odd to have a national policy, in my opinion, that basically boils down to we'd like to be in the middle of the pack. Do we want to be in the middle of the pack in our soccer team? I don't think so. Why would that be a national goal? In this case, I think we should be doing the best we can, whatever that looks like, using the incredible science and the incredible scientific leadership that the country has to protect children.
And so I want to talk about how we landed here, but first let's talk about the immediate impact. What's going on here?
So that's a good question, because in one sense, the immediate impact may be actually less than it appears. But in another sense, it might be more. So let's go through that. The first question is, what does it change tomorrow? And the answer is not much, because the administration went out of its way to make sure it was clear that families still had access to those vaccines that are no longer universally recommended. And that means that the Vaccines for Children's program, which is a federal program that actually distributes vaccines to more than half of the children in the country, will continue to carry those vaccines. And if the patients and their doctors want to be vaccinated, they can access those vaccines. Similarly, they expect private insurers to cover the vaccination. And so from a parent's perspective who's interested in vaccines, there's not much change. But from another perspective, which is what could happen to policies as a result of this shift, there may be bigger changes. And in particular, there's a concern that these vaccines that are no longer fully recommended may fall off the school vaccine requirements in some states, because it's a signal that these just aren't as important as vaccines. And if some states change their policies, because school entry requirements are state policies, not a federal policy, if some states change that and then parents get the message you really don't need to vaccinate against these conditions, you could definitely see a resurgence of illness affecting children in these areas. And these are some pretty significant diseases.
I just want to tease that out really quickly, only because our listeners might be familiar with the case of Florida, which has said that they are not requiring any vaccines at all. But you're saying that most states usually follow the HHS recommended schedule to make those kinds of policy requirements?
Yes, it's not usually one-to-one, because there's some vaccines that are really intended for small babies. And so they wouldn't be as applicable to when kids enter school. But by and large, the school vaccine requirements track the appropriate vaccines for that age. So that is definitely what could happen. More states could go the way of Florida. Now, Florida hasn't completely gone the way of Florida yet. They're still working through their... But it's not just what the formal policy is, it's also the message that's being sent. And if parents get the message that it's just not that important to vaccinate, you really could see the decline in vaccination. That's what then leads to an opening for the diseases to come back.
Talk more about the impact on trust and confidence in vaccines and how this might affect that.
So interestingly, HHS is saying that one of the reasons to make these changes is to improve trust in vaccines. I find that kind of implausible because it is wrapped in a whole set of statements in the various documents that have been released about problems with vaccination, inadequate safety studies that are alleged, and all kinds of various selective reading of the evidence about the potential risks of vaccines. It's sort of like the wrapper is pretty anti-vaccine, then you open it up and you're dropping recommendations. It all adds up to me to be a pretty clear sign to parents that they should have less confidence in vaccines. And I think their argument is, well, if we recommend fewer vaccines, then people will trust the vaccine recommendations that we're making. I guess time will tell, but count me as skeptical.
Before we move on to kind of how this happened, are there any other policy implications that we should chat through?
Well, some people were wondering whether or not this could change the vaccine liability standards that exist. The nation has a pretty sophisticated approach to vaccine injury compensation and liability protection. And the way that works, we've covered it in some podcasts, is that when there are rare vaccine injuries, parents can get compensation very quickly and generously from the federal government. And in exchange, there's certain types of liability protections for the companies. So it's much faster compensation in exchange for certain protections. And one question is, when a vaccine is no longer fully recommended, do those same protections, both for the families and the companies, still exist? And today, HHS said, yes, they do exist, and that fear is misplaced. So we'll have to see how that plays out, but at least that does not appear to be upended.
So let's now switch and talk a little bit about how this all happened. What was the actual process here?
That is a good question. There does not appear to be much of a process at all. Basically, what it looks like is a couple people within HHS, new arrivals with the Trump administration, both of whom have a history of all kinds of questionable statements about vaccines, wrote up a memo. They did the analysis themselves. It was not shared publicly. It was not reviewed with the career agency officials as far as you can tell. And then on that basis, the entire vaccination policy for the country changed. And I'll read you what the American Academy of Pediatrics wrote. They said, for decades, leading health experts, immunologists, and pediatricians have carefully reviewed new data and evidence as part of the immunization recommendation process. Today's decision, which is based on a brief review of other countries' practices, upends this deliberate scientific process. So it is just incredible to me, given how much thought and attention went into building the United States into a leader in protecting children from horrible diseases. Suddenly, with a stroke of a pen, they're trying to pull chunks of that away. And it's not because there's been a new, well-regarded scientific review. It's because of, basically a brief review of what other countries are doing. Let's just stick ourselves somewhere in the middle, and not a thoughtful and inclusive approach.
This also doesn't sound particularly transparent.
Transparency has been a bit of a buzzword for this administration, or the way they put it is radical transparency. In this case, out of the blue, no discussion, a memo comes down at the same instant a policy decision is made. It's really hard to imagine a process less transparent. Let me just give one example of the consequences of this lack of transparency. One of the changes that we didn't talk about is in the human papillomavirus vaccine, which protects against cervical cancer. That has been approved by the Food and Drug Administration as a 2-dose regimen. But the new recommendation says just 1 dose. And it says because some of the other countries use just 1 dose, we should do that. That's what it says. And the Food and Drug Administration has said to the company, we are not going to be in favor of 1 dose unless you can prove it's just as good at preventing cervical cancer as 2 doses. And they've talked about the kind of study that would be necessary to prove that. You'd think if you're going to switch from 2 doses of a cancer-preventing vaccine to 1 dose, you'd want to know that it's equivalent. And the Food and Drug Administration is the agency with the expertise to figure that out. Somehow, the national recommendation for this changed, and it's totally unclear what people at the FDA even think about it.
So far we've been talking about recommendations and who's making these recommendations, but is this legal?
Well, that's a fair question to ask. Typically, there are all kinds of processes that the law requires the Department of Health and Human Services to follow. Cannot make arbitrary decisions. They have to base their decisions on science. There are certain processes they have to follow for seriously consequential decisions. So it would not surprise me if there's some litigation over this.
Now, in going back to you're joining us in your capacity as a pediatrician, as someone who's worked at various levels of government, what do you make of this?
So this is a hard day for me, Lindsay. I believe that science and technology really can prevent absolutely horrible diseases. And I have taken care of kids with some of these conditions. And when you see a child suffering, you see the parents suffering, and you know that they could be prevented, it's hard to imagine a cavalier changing of the recommendations that looks like this. I also think from the perspective of someone who has worked at a local health department, a state health department, and the FDA, about how important it is to have integrity in the process you use to make decisions. That decisions should be made thoughtfully. People should understand the basis for them. There should be opportunities for input. This is not a process with integrity. And so you put those two things together. And I think here we have probably the best example in my career of a process with no integrity leading to an outcome that cannot be justified.
This has been hinted at for a while. Is this over? Are there any more changes to the recommendations that you could foresee coming?
I don't think there's any good reason to believe that there won't be more shifts in recommendations. There are a number of different processes underway at CDC that are going to be looking at different questions, again, led by people who have expressed a lot of animus against vaccines and a lot of distrust of vaccine science. Even in the memos themselves, they talk about this as an interim step before a whole lot more research can be done on vaccine safety. So I think that we're in the middle of a process here. And I think one of the impacts of this process is going to be to confuse people, to undermine people's understanding of vaccines. And it's going to be a very interesting and difficult period that we're going to have to get through, hopefully, and emerge on the other end with people recognizing the value of vaccines to keep their children from really terrible diseases.
Last question for you, Josh. As the parent to a young child, this is really concerning to me. If you were my son's pediatrician, what would you tell us?
I'd say that the evidence hasn't changed. The recommendations of the American Academy of Pediatrics have not changed. And that fortunately, the new announcements from HHS don't actually change your access and your child's access to vaccines. It's still possible to follow good recommendations, trust your pediatrician, and protect your children.
Well, sorry to keep you up so late, Josh, but thank you for walking us through this announcement.
Well, as always, thanks for having me on Public Health on Call, Lindsay. Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.